Back to hypertension and resistance training, I've spoken to Elaine about that, as well as what I've mentioned with regard to the precautions with breath holding and straining and no overhead and down, no overhead work and no head down work for sustained periods. Exercise is very beneficial for blood pressure. Not only is it good for the vessels to be expanding, contracting, it's good for weight loss, to help to reduce that blood pressure. And we might even, we will talk about a little diet too and see if dietary modifications can also help with the blood pressure. For example, reducing the salt intake, something like that. So we'll move on to that a bit later with Elaine. But another aspect of exercise which is a concern is asthma. And asthma is a very common disease really throughout Australia. 1 in 10 Australians experience symptoms of asthma. And asthma is a bronchoconstriction which causes the narrowing of the airways within the lungs, making it very difficult to breathe, particularly to expire. Asthma has many causes, and exercise in fact can be one of the causes for it. With other reasons that an asthma attack can be exacerbated would be allergy is a big one, smoke or infection, the cold. So these factors have to be taken into consideration when working with an asthmatic patient. With regard to a cardio workout, it's very important that the person themselves is very aware of their asthma and they're always carrying their reliever puffer with them. They need to have an asthma action plan. And generally those people that suffer with asthma will have a preventer medication, which is generally brown. Then they'll have the reliever medication. The reliever is only to be used generally when they're having an episode of asthma. So with an asthmatic patient or participant, it's important to warm them up slowly, and if you can, warm them up in a warmed environment. Sometimes that inhalation of cold air can trigger the asthma. So to be aware of the environment that they're working in is important. Start them off gently. It's a very slow warm-up for the asthmatic participants, and to be observing their symptoms and for them to be aware of their symptoms as well. I would be looking out for someone that had a cough, perhaps someone that developed a shortness of breath with not a lot of exertion, their colour, if they can speak to you, and just, I guess, being a bit more aware of the potential that they may have to deteriorate into an asthmatic episode, and to know when to call 000 if that's needed, because deaths do still occur in asthma. It's not a disease to be taken lightly at all. So to know when that person is getting not enough relief from their medication is very important to be aware of as well. So noticing their colour, their posture when they're breathing, and knowing when to call for help. That's